Hello viewers, good evening to all. This is Naveen from Bangalore. So today I would like to come up with an interesting topic regarding evolution management. One of the important topic called as presenting problem. Most of the coders they're struggling to get into accurate presenting problem irrespective of the complexity of the condition. Today I would like to bring a few notifications and few scenarios which is related to the most important presenting problem, nothing but undiagnosed new problem with uncertainty prognosis. There are a lot of ENM coders and ED coders that are struggling to fix this presenting problem. I've seen a lot of coders and most seniors as well. They're getting too confused when to take this undiagnosed problem with uncertainty prognosis. Today, I would like it to give you the best examples when we'll consider this presenting problem as a moderate complexity. So first of all, you should understand what is undiagnosed problem with uncertainty prognosis. So whenever patient complies with sign and symptoms, it is unconfirmed conditions. So if the patient got this complication, make sure that patient need to visit either ED department or urgent care department or their respective family physicians. If these sign and symptoms, if even though patient took some medications, if it all not resolved, so it's something bothering to the patient condition. It's patient need to attend, make sure that you need to meet the respective physician. According to the sign and symptoms, physician need to evaluate the patient in depth of the physical examination. You need to order certain investigation studies why this person is getting sign and symptoms. So according to the sign and symptoms, you need to evaluate, you need to order certain diagnostic interventions, and you need to identify what is the root cause of the condition. Make sure that the physician need to differentiate the respective diagnosis according to the signs and symptoms at the time of encounter. Here, differential diagnosis plays a vital role to identify what exactly the sign and symptom causes. For an example, if a patient complains with a dizziness or in a vertigo, so these are the signs and symptoms can be triggered. It related to otitis media. It could be related to neurological, or it could be related to some other factors. So based on the sign and symptom, based on the investigation, physician need to rule out these conditions related to which system it is. According to that, we need to fix it. After all the investigation studies, if physician is unable to rule out, still the diagnosis is dizziness or vertigo. So these can be triggered in future. In the present situation, current condition, physician need to give some medications to control for certain duration of time. So tomorrow or day after tomorrow, it can be triggered. So make sure that patient need to take care of the medications on time. In case if the symptoms get worsening, so the patient need to meet the respective physician. This is one scenario. The second scenario is, even though physician done a lot of investigation studies, he is unable to rule out. So either you need to consult the respective consultant physician. For example, let's take patients having some chest pain. So chest pain can be related to respiratory related, or it could be gastro related, or it could be cardiovascular related. So based on the sign and symptom, so physician need to investigate why this person is getting chest pain. According to that, we need to order certain investigation studies. Basic cardiovascular imaging studies like CT or chest X-ray, or some certain blood panels like CB, CCMP, some troponin analysis. According to that, we need to investigate why this person is getting chest pain. So based on the findings, if the condition is unable to identify, if unable to differentiate, so still my chest pain can be triggered, it can be leads to some other complication. So time being, physicians need to order certain medications to regularly follow the respective physicians if symptoms get worsened. So this can be taken as undiagnosed problem with uncertainty prognosis. So what do you mean by uncertainty? Uncertainty in the sense, as I said before, sign and symptom can be worsening based on the situation. So there is no equilibrium and there is no equality of the condition. It can be worsening or it can be subsided. So you cannot take this problem as a granted. As of now, the problem can be sign and symptom. If you are ignoring the condition, it can be leads to some other complications. So my request to all ENM coders and ED coders, whenever you got any sign and symptom, please don't take any condition as undiagnosed problem. Please understand the sign and symptom, find the physical examination, and what are the diagnostic interventions done by the physician, and what kind of treatments have they done. For example, physician can say abdominal pain without any investigation study. If simply physician order any pantoprazole or any antacid tablets, that doesn't qualify undiagnosed problem. For that abdominal problem, what physician has done separately, what kind of interventions they have done, what kind of treatments they provided, is there any follow-up, is there any do's and don'ts, is there any counseling, how to make the condition should be subsided. If condition is worsening in future, patient need to meet the respective physicians without any fail. Hope this video can useful to all of you. If any questions, you can comment on the chat box. I'm here to help you. Thank you all. Have a nice day.